to the Hormone Café. I'm Dr. Sarah Pederson. I'm an OB-GYN and I specialize in holistic women's health and fertility. Please grab a cup of tea or coffee. Today we're going to be talking about everyone's favorite subject, vaginal health. Why do I care so much about your vaginal health? What are symptoms that your vaginal health could be off? And then what do you do about it? Number one, the reason that your vaginal health is so important is because in women, our vaginal tissues are connected to the entire inside of our body. Our vagina is connected to our cervix, which is connected to our uterus, which is connected to our fallopian tubes, which literally pour out into the inside of our abdomen or our stomach. So it's very, very important that your vaginal health is very good. You have a healthy vaginal microbiome because it actually connects to your entire reproductive tract and your bladder. And of course, I want your vagina to feel great every single day. I never want you to have to think about your vaginal health, and it really impacts your fertility. So one thing that we do often with our patients is I often have them come and do a vaginal swab to check vaginal microbiome. And what are all the different things that we test? We test about 25 different aspects of your vaginal microbiome. For example, when you just go to your regular OB-GYN, they're testing about 1 or 2 species of BV or bacterial vaginosis and about 1 species of yeast, so Candida albicans. However, we'll test for 5 different species of yeast and about 20 different species that could cause bacterial vaginosis or throw off your vaginal microbiome, and then other really important things like Prevotella, Mycoplasma, Ureaplasma. If any of those things are positive, they're very easy treatments and it can really help your overall health and of course your hormones and your fertility. It's very easy to do. We swab you here, or we have you do a swab on your own, or if you live out of state, we often have you order a swab, do it at home, and mail it back in. So lots of options to check your vaginal health. So what are some symptoms that you might have that you know that your vaginal health is a bit off? One is dryness. If you feel like your vagina is a little bit dry, or when you have sex, you need a little bit more lubrication, the tissues aren't rubbing together, that could be a sign that your microbiome is off. Another is your cervical mucus. If you either have way too much cervical mucus, you just feel like you have discharge or mucus all the time, or if you have none, you go through a whole cycle and you never think, oh, I had cervical mucus, or I knew when I was ovulating. Those can be signs of an imbalance in your vaginal microbiome. Sometimes, of course, people feel itching. Itching is never good, either on the outside or the inside of your vagina, or just a sense of discomfort, like something's a little bit off down there. Other things that could be a problem are if you ever have a smell or notice that you have a smell in your vaginal area, or if you have a smell or a significant odor when you have your period. Those can all be symptoms of having issues in your vaginal microbiome. Other things are if you bleed when you're not supposed to. For example, if you bleed when you have sex, if you bleed when you're ovulating, or if you bleed in the middle of your cycle, if you have spotting or bleeding before your period, we definitely want to make sure that your vaginal microbiome is healthy. Other symptoms can be recurrent miscarriage. I see very often people come to me, they've had 1 or 2 miscarriages. We check their vaginal microbiome. They have something like ureaplasma. We treat it with antibiotics. They're able to get pregnant and maintain a pregnancy. Because if your vaginal tract is off or it's growing an abnormal bacteria, that can get into your uterus. That can cause a hostile environment for the baby to implant and grow and can cause miscarriages. So vaginal microbiome is extremely important in having a healthy pregnancy and miscarriage prevention. Another thing that they've studied a lot is bacterial vaginosis in relation to pregnancy health. It's been shown that if you have bacterial vaginosis, you're more likely to go into preterm labor or have a preterm birth or have your water break early because you're just living with a little chronic infection, and that can hurt that sac, that amniotic fluid sac that the baby's in, and cause it to rupture early. So even in pregnancy, I always check all my patients' vaginal microbiomes because I want to make sure everything is intact to set you up for 100% success for a future pregnancy. So let's say you come in, we do a swab. What are the different things that we might find? Big things that I often see, of course, are bacterial vaginosis. And bacterial vaginosis, while it can be spread in between partners, it can often just be other reasons why you might have your vaginal microbes off. The most common things that we hear, for example, are you left a tampon in too long, you were in a hot tub for too long, something obvious why you got bacterial vaginosis, but sometimes the cause is not obvious at all. Having bacterial vaginosis in your vagina is kind of like having a UTI in your bladder. Sometimes we know why we got a UTI, and sometimes we have no idea and it came out of nowhere. Bacterial vaginosis can be very similar. And the hardest thing is sometimes we have no symptoms at all. Oftentimes I ask my patients, was there any signs, any red flags where you would have known that you had gotten this infection? And they say no, had no idea. I wouldn't know. So I test almost every single person who's either having fertility issues or had miscarriages or abnormal bleeding, because it's definitely something that you don't want to miss. A vaginal infection or a dysbiosis or an imbalance in your vaginal microbiome. So we do a test. If it comes back positive, oftentimes it'll come back positive for things like Prevotella. Prevotella is extremely important to check for because it makes biofilms. Biofilms are these little coatings that your body will put around the bacteria to wall it off, and that can be really difficult to treat. Or commonly, I see ureaplasma and mycoplasma. And then we'll give patients antibiotics, which of course in general we want to try to avoid antibiotics as much as possible, but there are very specific circumstances where antibiotics can be extremely helpful. Oftentimes I give patients a round of doxycycline and they're able to get pregnant the very next cycle because now they have this infection treated, their body can have a healthy environment to grow a pregnancy, they can make proper cervical mucus and get able to be pregnant more easily. Another thing that I've seen is really rare types of yeast. Sometimes patients come to me and they have recurrent bacterial vaginosis and they go to the doctor and they get antibiotics and then they're itching and then they go to the doctor and they get antibiotics and they're just in this cycle and spiral having to take all these antibiotics. And we find that they actually have this really rare species of yeast that isn't even responsive to the antibiotics that they were given a whole bunch of times. So we actually have to give a really unique type of antibiotic or a really unique treatment profile. And then it's extremely important that you retest, because oftentimes people say, oh, I have some itching, I got some antibiotics from my doctor, and they never retest. And we never make sure that it actually went away or got treated. So big things are, you want to be tested if you have any red flags, or even if you don't have any red flags, it's so important just to check your vaginal health, check your vaginal microbiome. And if we find something, usually we can give either oral antibiotics, vaginal antibiotics, oral probiotics, around vaginal probiotics, or boric acid. There's lots of different treatment options to find an infection. And then if you have an infection, I always make you re-swab, because it's really important to me that we actually treated the infection, because sometimes people have such poor vaginal microbiomes and their gut or their vaginal microbiome is just really off. It takes multiple rounds of treatment to put it back together. Another thing that's really important is our partners, because it's so easy to pass things back and forth. For example, ureaplasma, something that I see very common, it's sexually transmitted, but sometimes you can have it for years and years and never ever know that you had it because most people don't test for it. So ureaplasma is something that I test for often, and we definitely need to treat partners. So we'll treat you, we'll treat your partner, and then we'll have you re-swab and make sure both of you are negative. And that's the same thing with bacterial vaginosis. Traditionally, because it's called bacterial vaginosis, we used to think, oh, men can't get it because they don't have vaginas. But that doesn't make any sense, because of course men can get it, because if we're having intercourse, we could pass things back and forth. So there was a great study that came out this year in the New England Journal of Medicine that said, oh, actually we should be treating men, which totally makes sense. We should be treating men. So if we find that you have an imbalance in your vaginal microbiome or bacterial vaginosis, a specific type of bacteria that's causing an infection, we also treat your partner. And then we make sure that both of you are negative so that you're not passing anything back and forth and just resetting that distress to your vaginal microbiome. So all those things are extremely important. Please, 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 if you ever test positive for an infection, always make sure that you retest and then it comes back negative. Those things are extremely important. Other things that I want you to know is your vagina should be a self-cleaning oven, meaning it should clean itself. Yes, sometimes we have to give antibiotics, sometimes we have to do probiotics, but in general, please don't try to clean it. Everything that you put inside your vagina should be designed to go in there. For example, a lot of people will feel like they're dirty and they'll try to clean it, either with water or douching or something like that. That can really throw off your vaginal microbiome. So please do not try to put anything inside your vagina to clean it, only the outside. Anything that you put inside your vagina, you have to make sure it's the same pH as your vaginal tissues. So for example, oftentimes I'll have patients use something called Refresh pH vaginal gel just to reset their pH, especially patients who feel like they have sex or their pH is not exactly the same as their partner. So every time they have sex, they're getting a little bit irritated in their vaginas. Sometimes it's helpful to put stuff like Vaginal Refresh pH gel just to reset your pH and make sure that having sex, because if your pHs are different, that doesn't just throw off your vaginal microbiome and give you BV or a UTI. So that's one thing. If you're going to put any lubrication, gel, anything, make sure it always has the same pH as your vagina. So please do not put anything in your vagina like yogurt, coconut oil, vitamin E oil, tea tree oil. Those things don't have the same pH as our vaginal tissues, and they can make infections much worse. Those things can be used on the outside, but we never want to use coconut oil as a lubrication for intercourse. We only want to use a pH-friendly lubrication if we feel like we need lubrication. So only things that go in our vagina are designed to go in our vaginas, meaning they're the same pH, nothing that's a different pH than your vaginal tissues. Another thing that I want you to remember is sometimes people feel like they need to feel inside their vagina and feel their cervix or feel their cervical mucus. Please do not do that because our fingers are dirty. We can introduce a lot of bacteria from constantly putting something in our vaginas. So when you're testing cervical mucus, it should come out when you wipe. You shouldn't ever feel like you need to feel up inside your vagina or feel your cervical mucus. You should just be able to wipe and feel your mucus. So of course, every once in a while, we have to take a feel. We need to make sure things are okay. But in general, you want to make sure you're noting cervical mucus as a discharge more on the toilet paper. Then you have to reach inside and feel. So when we're thinking about normal vaginal health looks like you never think about your vagina. It doesn't itch you, it doesn't bother you, it doesn't hurt, anything like that. And you go through your whole cycle and you have a dry spell, you have good high quality cervical mucus, egg white discharge around the time of ovulation, and then you go through a dry spell and then you have your period, and your period starts as a red flow. If you have anything different than that, we definitely want to make sure that your vaginal microbiome is healthy. Other things that can throw off your vaginal microbiome, like how do we get these BV infections? How do we get these yeast infections or ureaplasma or mycoplasma? One thing is our partners. Sometimes they either have a different pH than us, or they had ureaplasma and they passed it on to us. So that's why, how I was talking about, it's very important to have partners get treated. Other things that can really throw off your vaginal microbiome is your hormonal health, because your vagina needs to see a certain amount of estrogen in order to grow blood vessels that support the natural pH of your vagina. So if your estrogen is way too low or way too high, both of those things can throw off your vaginal health. So hormone balance is huge. Also, what we're eating is huge. Yeast loves sugar. If you're a kind of person that's having a lot of recurrent yeast infections, oftentimes I'll have you be very, very low sugar, meaning We're not eating a lot of pastries. We're not adding honey to our coffee. We're not adding maple syrup. We're not doing any artificial sweeteners. We have a treat every once in a while, but we don't make that part of our day because we don't want to continue to feed that yeast with sugar. Another common thing that yeast loves is refined and simple carbohydrates. So we don't want to be eating things like white bagels, white bread, buns, pastries, brownies, ice cream, that kind of a thing. We want to keep it very rare and not incorporate that into our diet every day. If you're a person who has really recurrent yeast infections, oftentimes they'll have you completely cut out sugar, cut out white carbohydrates until we know that the yeast is cleared, and then really thoughtfully introduce some of those foods back in a way where it's not going to just flare up the yeast and grow it again. Oftentimes too, if you have yeast in your vaginal tissues, you could have yeast in your gut. So it's very common that I'll go ahead and test your gut if your vaginal microbiome is off, or if we see certain things on a vaginal swab, because some of those things can point to issues in your gut. Candida overgrowth in your gut, a microbiome imbalance, or we call it a dysbiosis in your gut, because your anus and your vagina are right next to each other. So anything that's going on in your vagina and your bladder can affect your gut and vice versa. So it's really important to make sure all of those things are healthy and clean, because sometimes if we fix your vaginal health, but we never fix your gut, we're not actually fixing the underlying problem of why your vaginal health was off in the first place. And then your gut can just cause additional issues with your vaginal microbiome. So it's important to look at that whole spectrum of things, make sure there's no red flags with gut or bladder when we're thinking about our vaginal health. And sometimes we know why we got an infection, and sometimes we have no idea. Or people say, oh my gosh, I have no idea how I got this infection. Like, how do you get an infection? And that's okay, because we know that our vaginas are open to the world, and sometimes bacteria can sneak in and throw off our vaginal microbiome. So I'm very, very passionate about vaginal health. It's very important that you have a normal vaginal microbiome, you feel amazing every day, your vaginal tissues never ever bother you, and that we know what the red flags are. So make sure that you always feel great every single day. You're not having any itching or any discomfort in your vaginal area. If you've been trying to conceive for at least 3 months, you're still not able to conceive, or you've had miscarriages, I would definitely do a swab and check your vaginal health. So everyone's favorite topic. I know everyone's super excited to hear about their vagina, but please make sure your vaginal tissues are very, very healthy, because it's super important to you as a woman, super important to your health. Thank you for joining me on this episode of the Hormone Café. And next time we're going to talk about miscarriage and some of the things that we can do to prevent miscarriage. Until next time, keep your vaginas healthy, please.